Welcome to the brand new Children's Hospital by Samitivej. The talented staff here are utilizing state-of-the-art facilities to improve the quality of life of their patients every single day. In order to learn more about the amazing care on offer here, let's take a tour with Samitivej's Director of Marketing, Nicolas Leloup.
We're very excited to get you here to show you around in our new facility, the just newly opened Children's Hospital. Samitivej was the first private hospital to open a children's dedicated private hospital in Thailand in 2003. And ever since, I think we're still the only one. So we have the largest pediatric teams of any private hospitals in Thailand, going from any primary care to all tertiary care. It's grown and we've become a reference as a regional hospital in Southeast Asia. And we decided it's time to get our own building. So this is the main entrance, and when you arrive, you see the nurse here. She'll do the primary screening. If your kid is sick and has fever or infectious disease symptoms, we'll go to the isolation room. All right? And then, as you can see right here, is an elevator. So if you need to go to see a doctor, you have a separate pathway to go straight to the infectious disease area to see all the doctors, the consultation rooms, and the admission rooms, so that you're completely separated from the people who come to see here to visit a specialist or something. So we have two different aircon flow, so there is no contamination possibility between this non-infectious area and infectious area. And so we really try to minimize as much the infection risks. So when it comes to pediatric care, we are reference points in the Asia-Pacific regions. So we get patients referred to us from as far as Bangladesh to Indonesia. So we cover all the region. So we have our own medical escort teams that go fly and pick up patients to bring them to Samitivej Children's Hospital for treatment. The other points for us is that we have the proximity with Suvarnabhumi Airport, and so the 20 minutes from the airport ride makes it also a hub for medical referrals, pediatric medical referrals to Samitivej, to Bangkok. So we have a lot of patients internationally, they fly to us, and the ER serves as the entry point for the entry of care in the Children's Hospital. So that's why it's very important for us to have a good liaison between air transportation, ground transportation, and the medical teams here. So the ER will serve as managing all of this logistics and makes us be able to receive patients from the entire region.
So we try to make our room look like the bedroom for the baby, but we also keep the safety for the patient. We have like monitor, like the ICU things to make the patient safe. We have music that we consult with music therapists that what kind of song that can make the children relieve, like white noise or slow pace of the music. So our priority is one to make sure that patients are comfortable with us.
Where are we right now?
So this is a dispatch center, and this is where we follow all of our ambulances and emergency situations. We have patients being referred to us either from their home or from other locations, other countries, and the ambulance is going to pick up the patients. In the ambulance, you have all the medical equipment and also a medical team with doctors, ER physicians, and nurses. The medical equipment is synced in real time with our reading monitors here, so that the doctors waiting for the patients to arrive already can monitor the patient situation. We can also monitor about like the traffic, how long it's going to take, so we are ready as soon as the patients arrive.
Wow, that's amazing. So this is like a central command center where all of the information is updated live.
Yes.
So that everybody who's needed on the other side of things, they're ready and informed with all the information that they need before the patient even gets here. Okay, Nicholas, the Pediatric Neurological Department. What's this all about here?
Imagine your child is suffering from epilepsy. So this is the department where you would come. Okay. We have vagus nerve stimulator therapy. So it's like a brain pacemaker. All right. So you have an implant in your body that is related to your nerve, send impulses that will go straight to your brain and regulate the brain cells activities.
Wow.
And so this will help to control the brain activity and minimize the symptoms of epilepsy.
All right, Pediatric Operating Center. What do we have going on here?
For children, it's different from grown-ups in that sense that their bodies are smaller, the heart rate is different, much higher, much faster, the thresholds are different. So we have a team of pediatric surgeons, and the operating theaters are designed for operations on young kids. Most of it is laparoscopic, so we use laparoscopes through incisions as small as 2 millimeters. Everything is then on 3D monitors, and the doctors can magnify as much as they want and really focus on the operation that they're currently performing. Right after that, we can take them into the pediatric or neonatal intensive care unit for recovery.
Wow. All right, so yeah, I feel like I'm in one of my favorite medical dramas here. Can you describe to me where we are right now? Yeah.
So we're in the pediatric intensive care unit and neonatal intensive care unit. So this is where a lot of the critical cases will receive care. And as you can see, so you have an island where we can monitor all of the cases. Each individual room has a nurse in front of each room, so there is 24/7 constant supervision. And one of the area where we're trying to develop our medical expertise is by doing medical collaborations with overseas hospitals. So to help us manage and develop our program for pediatric intensive care unit and neonatal intensive care units, we have collaborations with Don Baker Hospital in the US and with Takatsuki Hospital in Japan. And so our doctors receive training from the American team and the Japanese team and develop the programs and adjust the guidelines and the treatment protocols along with our partners overseas. And so this helps us to develop skills tailored to international patients.
At their dedicated pediatric ICU floor, featuring NICU, PICU, and the specialized PPCU, every child receives one-on-one care. The PPCU prepares parents to confidently care for their children at home. Their multidisciplinary team and advanced technologies, like robotic-assisted gait training, red cord NEURAC, and smart IPD, streamline communication, boost safety, and speed up recovery. Here, they deliver state-of-the-art care for the most vulnerable patients, because every child deserves the very best.
Nicholas, any parting thoughts for us today?
No, actually, I'm very excited for the opportunity that you grant us to be able to show our new hospital, our new facility. I hope you understood that our idea, our vision is to serve the local community, but also beyond our local community is to be able to demonstrate the medical excellence in the Asia-Pacific regions and to be able to serve all of these patients that need care, especially all of these children that don't have access to pediatric care and that they can get it here.
Fantastic. You've instilled a lot of confidence in not only me, but hopefully our viewers as well. Thank you so much for all the work that you're putting in here today.
My pleasure.
Thank you very
much.
much.
It's time to have kids now.
Pressure's on. Good God.